There you go.
This is the primary assessment video for Carrie Filippetti. We are dispatched to the scene for a one down involving a 35-year-old male. When we arrive on scene, we notice the male lying supine next to a tall ladder. Our first step is to determine that the scene is safe and put on our personal protective equipment. I ask my partner to bring the cot, a trauma bag, and a backboard in case of a spinal injury. This is now where the primary assessment begins, where the objective is to identify signs of life threats and help mitigate them. So the primary assessment begins with a general impression, and as I approach, I notice that the patient appears calm with open, blinking eyes, but he seems to have limited movement. I walk up to him and introduce myself as EMT Carrie Filippetti. I ask for his name, and he responds, which demonstrates he's alert with a clear airway. I then confirm his breathing is adequate and determine the pulse is regular, although it is a bit rapid. And as I perform these ABCs, I continue to engage with the patient. I ask what happened, and it's explained that he fell off the ladder about 15 feet from the ground. He is worried because he has some lower back pain, and he's not moving because he's afraid that he may exacerbate the injury. I ask for a bit more details, particularly if he's experiencing any tingling or numbness that could be associated with an injury. I advise him that my concern is that he may have injured his back or his neck, and I ask if my partner can perform C-spine to help stabilize, and that I can have consent to do a quick assessment to determine if there are any other injuries. After gaining consent from the patient, I'll perform a rapid trauma assessment to check for any more serious life threats that he may not have identified because of a distracting injury. So I'll check from head to toe, palpating to see if there's any response, any other injuries, any bleeding. Check the sternum. I'll check all four quadrants of the abdomen. Check the pelvic area. Go down the legs. Again, checking for any signs of more serious injury. Checking the arms. And then after that, we'll do a proper log roll and check down the back. Once we've done this, we'll roll him back onto a backboard where, given the mechanism of injury and combined with the ABCs, I would qualify the patient as priority 2 just because of the fear of a back injury. We would then move the patient onto the cot and into the ambulance where we would perform a history taking and a secondary assessment en route to the hospital.